So Jedd, I wanted to say, and now for something completely different.
Thanks. And thank you, Kathy, for the very good introduction to the concept of the difference between treating the tumor and treating the patient. We've spent an awful long time as oncologists and researchers trying to find ways to treat tumors. And we've accomplished a tremendous amount in that regard based upon the success of chemotherapy, radiation therapy, and now targeted therapies that get in the way of the pathways that drive cancer cells to divide. And diseases like breast cancer are clear examples of how those medicines can cure people and prolong life. However, there's another side of this equation, and that's the person who has the cancer, the patient themselves. And people who are in my field of immunotherapy have long thought that cancer could possibly be recognized by our own immune systems as being something foreign and dangerous and gotten rid of like an infection. We all know that our immune systems are quite good at getting rid of cells that have a virus or bacteria infecting them. And the wild success of childhood vaccinations for infectious diseases is really a very clear example of when the immune system is properly trained, it can be very protective and, in fact, therapeutic. And so for many years, we and others have tried to understand more about how the immune system tries to see cancer, how we can help that process happen. In many ways, cancer is a very intelligent beast, no matter what kind of cancer we talk about, because not only has it developed ways to divide in an uncontrolled way, but it has also developed ways to cloak itself from the immune system, to make it look like a normal cell in your body that the immune system is not supposed to respond to. And over the past decade or so, we have learned more at a very fine molecular level about what turns the immune system on and off. And now we're in a position to try to apply that in patients with cancers. And we're doing that in several ways. One part of our work at Memorial that this group has been very generous in supporting has been specific immunization or vaccination against a target that you're all quite familiar with called HER2, which is present on many breast cancer cells. And we have developed a very novel form of vaccination called genetic vaccination, which is now being used in a clinical trial in women with breast cancer after they have completed their other adjuvant therapy. And we hope to complete that study in the next year and report the results of how the immune system has been educated by that vaccine. At the same time, we have been using more powerful modulators of the immune system, medicines that turn off the brakes that normally keep your immune system from reacting to things in a very robust way. And one of those medicines has a very long name called ipilimumab, or IPI for short. And this medicine was actually approved to treat advanced melanoma about 1.5 years ago, the first medicine really ever to be shown to prolong life in patients with advanced melanoma. And now, in collaboration with Larry and Heather MacArthur, we're doing a study of this medicine in women with newly diagnosed breast cancer before undergoing a mastectomy to see what the immune system can be trained to do in a tumor while it's still in a person's body. This is a very novel approach to combine an immune therapy, and in this study it's being combined with a local form of tumor destruction called cryoablation, which basically turns the tumor into an ice ball before it's removed. And we believe that this type of combination approach where the tumors are killed in some way, whether that be with chemotherapy, radiation, cryoablation, and then the immune system is tuned in the background with these new medicines that are available to us, that we can deliver on the hope of making these tumors go away and, importantly, stay away.
Great, thank you.